Hello, everyone. Welcome to our post COVID in person, online um, demonstration. So, we're doing live demonstrations today on different body sculpting areas. I'm Dr. Scott Terry, and we are filming live and in person. Um, at Allure Wellness Center. We're located at 7151 183rd Street in Tinley Park. And I'll give you the phone number in case you want to call. It's 708-864 4988. So today's live demo is all about body sculpting. Now, what I tell people with body sculpting is that this is not a weight loss procedure. None of them. They are strictly here for those areas that you have problem areas and you want to actually do something that is non-invasive without any downtime. So, today we're going to talk about cool sculpting. We're going to talk about BTL Exilis. So, cool sculpting is actually reduces fat. BTL Exilis is skin tightening. It will reduce some fat as well. And then Emsculpt is once you've kind of gotten taken care of that fat, now it's time to actually get those muscles toned. But more than just toning those muscles, it actually helps you build your core strength. So we're going to do a quick overview of all three of those procedures. And then we're actually going to go show you all the live demonstrations. I know a lot of people are working this afternoon, so we are doing a second live demonstrations from 5 to 7 today. So if you want to actually try out the Emsculpt machine or see the actual live demonstrations of cool sculpting and the BTL Exilis skin tightening, call us, come by. We'll be starting those demonstrations at 5:30. We'll do another talk again around the same time. About 5:15, we'll start the talk, but we'll do the demonstration starting at 5:30. So let's start with cool sculpting. Well, let's start with fat. This is 5 pounds of fat. You can't hold it because you're not here, but, but it's heavy. And this is what 5 pounds of fat looks like. So when we're talking about doing the cool sculpting. The cool sculpting is a non-invasive procedure. And how it works is it freezes the fat cells to the point where those fat cells will die. After they die, they actually get metabolized through the liver and excreted out of your body. Once those fat cells are gone, they are gone. They don't come back. However, if you gain weight, it is going to go somewhere. So cool sculpting does about it's not invasive. There's no downtime. We've had people come during their lunch hour. You can do any area from the chin to arms, abdomen, inner thighs, outer thighs. All of those areas can be done with cool sculpting without any downtime. Um, Once again, it's pretty quick. It is more of sculpting an area that you are concerned about. We have lots of pictures on our website that actually will show you before and after. Some people will say, "Well, do I have a lot of sagging skin?" Usually, if if you don't have a large volume, because I wouldn't suggest if you have a large volume to do cool sculpting. That's not what it's for. It's more so for sculpting an area. But it does do some skin tightening. It's not necessarily FDA won't have those claims that it does skin tightening, but it will do a little bit of skin tightening. But the main goal for cool sculpting is going to be to reduce fat in a problem area that you have by about 20-25%. So that's cool sculpting. Now, on to the BTL Exilis, which is more skin tightening. So we have a lot of people who love doing the BTL Exilis because you can tighten any part of the body. We've had people, one of our most popular areas is eye, neck, and chin. Um, Definitely, we can do the abdomen, you can do arms, You can do inner thighs, outer thighs. You can do any part of the body to tighten the skin. So what the Exilis does, how it works, is it is radio frequency and it is also ultrasound technology. So it also helps with the elasticity, which a lot of people need. So it's not just tightening, but it also will help with the elasticity. Um, we're going to do a demonstration on a neck shortly after I'm done speaking. And then we'll probably do an eye sometime today, just so you can kind of see the effects. Anytime you are doing body sculpting, rebuilding collagen, tightening skin, the process takes 8 to 12 weeks. So you don't, when you're doing the skin tightening, you'll see some benefits that day, but it's not the permanent benefits. Anytime you're doing, I don't care what it is, whether or not it is laser, whatever, it's going to take anywhere from roughly 8 to 12 weeks, usually at 12 weeks. But that process is how long it will take for you to see the final results. So I tell people if you need to have immediate results, well, I don't know. But it is not going to be something that is going to be rebuilding collagen, tightening skin, getting rid of the fat cells, even with liposuction. It does not happen overnight. Most people see their best results anywhere from 3 to 6 months. So one thing I tell people, it's September. The holidays are coming. This is the time that if you are trying to really work on those problem areas, you got a party to go to, you have an event, birthday, holidays, this is the time to actually get started so that you will be ready when those events start taking place. And last but not least is the Emsculpt. So anyone who's coming in today, if you want to feel with the Emsculpt, feels like we can put you on the device, let you see the intensity of it. How Emsculpt works, it is, I won't go into all the technical details, but it is equivalent to doing 20,000 sit-ups with one session. It is stimulating those muscles, but it also goes through different cycles where it helps you not build up so much lactic acid that you're in so much pain afterwards. You know, when you worked out and you've done some sit-ups, you've done 15 and your stomach is hurting the next day, well, you don't have, well, this is equivalent to doing 20,000, and you won't be as sore. You'll feel it because it is definitely helping with building those core muscles. With the Emsculpt, it's not just the stomach. You can also do the butt, so it can kind of give you more roundness and give you a little bit of a lift. You can do the arms. You can do the calves. So there's different areas that actually help to tone those muscles. A lot of people will do it because they have back pain, because their core muscles are weak. It definitely, anyone who's done the Emsculpt, they always say they feel better because it actually is tightening those muscles. People who have a diastasis where the muscles are kind of like split happens a lot after you've had a baby. It actually helps to tighten those muscles again so that you don't have that display of your muscles kind of splaying apart. And it does give you a six pack. But once again, this is not necessarily for weight loss. This will reduce some fat, but it is actually meant to actually build more muscle. So if you have a larger volume of fat, we have to take care of getting some of the fat down first before actually really honing in on those muscles. Will it help your back pain? Will it help your core muscles with doing the Emsculpt? Absolutely. We've had golfers do it because it helps with their swing, because it helps with their core. So that's kind of a brief overall of all of the different body sculpting devices that we have at Allure Wellness Center. We're going to start doing some demonstrations so you can actually see what it looks like. And you'll be able to, if you have questions and you're watching online, you can ask questions. And then we can kind of talk you through some of your questions or some of your concerns. So the people that are here, they're going to follow me into the room. So come on with me. Oh, Here are our lovely ladies. They hate to be on camera. This is Jessica. This is Rachel. so they are on the phone. They will be able to take some of your questions. If you want to schedule an appointment, you can do that. Everything is 20% off today, Friday, and Saturday. So call if you've been thinking about it. The price wasn't where you wanted to be. Well, everything's going to be 20% off today, Friday, and Saturday. So they will be ready and willing to take all of your calls. Okay, thank you, ladies. Okay, follow me. We're going to go to the back and start doing some demonstrations. So this is our spa side of our new center. This is Coolsculpting. So these are some of the pictures, and if you go to our website at Allure Laser Med Spa, this is, you'll see our own pictures where you can see the before and after. But this is like a before and after. I don't know, can you see this? You ready first?
No.
Okay.
In 2 seconds.
This is a before and after. So this is her before, 12 weeks. Remember I said those 3 months. This is before and after. Let's see if you can see this a little bit better. This is a chin. So if you don't want to have liposuction, which we do, this is non-invasive, okay? This is an arm. This is before and after. So once again, the full effect is 12 weeks. Will you start to see some of the changes before 12 weeks? Yes. But the full effect is going to be 12 weeks. And once again, most people don't have any downtime when they're doing Coolsculpting. Non-invasive, people come, get whatever they're gonna do, go back to work. So this is what we're gonna start off first, actually seeing that's Stephanie, she's gonna see her in a second. Because we're gonna do our first demonstration. I can actually show you what some of the BTL, let's show you some of the, while she's still getting ready. This is skin tightening. You may have to come a little closer to see this a little bit better. This is eyes. So once again, one of our most popular treatments is eyes. Because it actually helps with the lines, it helps with tightening the skin, it gives you more of a lift. And you see, like, so with the eyes, we can do what's called a double treatment, where we actually do double the amount of time so that you actually see the results a little bit quicker. But the eyes are the only area that we usually do this for. This is before and after, this is skin tightening. So this is of her arm. So it'll give you some tightening of the arm. If you have a lot of laxity, it is not going to probably give you what you're looking for, but that's for skin tightening of the arm. And if you come down here, you can see this is her before, this is after. So she did her abdomen. So you can see that her abdomen, the skin, is a lot tighter. One thing I always tell people with the BTL skin tightening, you have to be hydrated. Because if you are not, your cells, the temperature gets hotter a lot quicker, and it's harder for you to tolerate the procedure. But as long as you're hydrated, this is not painful. Most people actually enjoy it because it's a warm treatment, and you get great results. So, we're ready for the Coolsculpting?
We are.
Okay, so we're gonna start with the first client. Hello, how are you? Okay, so come on in. We're live streaming here. She's already been marked. So usually after all the markings are done, and this is what me. And that's Stephanie, who is going to be doing the actual procedure. Um, I won't say your name. We'll keep you anonymous, but she's already marked up, so that's the first thing we do is mark everything up, get you comfortable. We do have TVs if you take about 30 minutes to do. There's some that take a little bit more, like the
equivalent to doing eye surgery where you're doing a blepharoplasty, where you're actually making incisions and removing skin. But it actually does give you a lift. It makes the area tighter. It gives you your eyes look a lot brighter, and then it also helps with lines. So we'll show you her before, and then we'll show you her after.
Whoops, sorry about that.
This is our
7150.
oh, I'm gonna put up a picture. This is today, Georgia.
Go to, should be.
Oh.
Oh, wait.
I'm gonna show you a picture. And she's had this treatment before. So that's one of her before pictures. This is the other side. And it's actually, I've had it before. It's actually a very relaxing procedure. Um, Georgia likes to hum, so she hums you to sleep.
Tip.
Okay. Let me grab the tip. I'll be right back.
Sorry. It's just system.
Is it a one-time procedure?
No. You can for maintenance. Usually we suggest doing at least 4, and you space them out between 7 to 10 days.
Okay.
This treatment for the eye area is anywhere, you can do anywhere between
Okay, here's the
procedure last.
So so this also builds collagen. So I tell everybody, anytime you're building collagen, it's gonna take 12 weeks for the final results. I don't care what procedure it is, but most people, for the eye, we usually do 4 treatments. We do them 2 weeks apart. This is the one that I said you have to be hydrated because the more your cells are hydrated, we try to get you up to the highest temperature that is for that area. The more your cells are hydrated, the more you can tolerate, the higher we can go. But it usually, most people will do, once you do the 4 treatments, they may do one. Some people do it once every 3 months. Some people will do just one. They'll do once every 3 months, maybe once every 6 months. I wouldn't go longer than a year because as long as we're living, the collagen is going to continue to break down. And then I also tell people to do things in between. You can go ahead and start, Georgia.
Okay.
I'll talk while she's doing the procedure. And it is a nice, relaxing procedure.
2 questions. What about eye puffiness?
Does this cause it or does it get rid of
I
it?
believe can you get rid of it?
So it's not necessarily, if you have a lot of, and it depends on what it is. Some people have a lot of fat that is underneath the eye. This won't get rid of that. It may help it, but it won't get rid of it. Um, and we would have to actually do an in-person consultation to actually see you. I don't know where I should be looking. So what's the second question?
The second question, can we see the before and after pictures of it? Did you show those already?
I showed the before, and so we'll put it up after we're done, the before and after. So you can kind of see, and like I said, she's had it before, so we can show you where it started and then kind of where we end up. We have a ton of pictures on our website of all the procedures. So we have pictures of the BTL, which is the skin tightening of different areas, the abdomen, the eye, the neck. So we have different areas that we treat. We also have pictures of the Coolsculpting. We have pictures of Emsculpt. So and these are actually clients that we have done. So if and all the consultations are courtesy, so there's no charge to come in and have a consultation done because we want to make sure that you're getting the treatment that you are looking for. Okay. How are you doing?
Good.
Okay.
Does this help with crow's feet?
It does. It does. And so it helps with all fine lines. It's going to rebuild the collagen. So it helps with giving it more of a lift. So because it'll lift this top eyelid as well. It helps with if you've got lines underneath the eye, if you have crow's feet, it helps with all of those areas. So yes, it will help with that. Once again, if you're doing your abdomen, it helps with tightening the skin on the abdomen. Once again, this is not a painful procedure. And most of the time it's pretty relaxing. We're just in here talking. so she has to deal with us talking. Any other questions before we move to the Emsculpt? Okay, we'll be back so you can see the after. Okay, so we'll go into the Emsculpt room and actually kind of, so you can see the device, get it set up. You cannot have metal in that area if you are doing Emsculpt. Who wants to be a model for the Emsculpt? Come on. So,
I like it. Yeah, but she's not so model. She's like a
yeah, do it.
So, I'll let you sit here. So, what I tell people, you will feel it. You probably, most people when we first start, we don't start to at 100%, but we can kind of get up there. You kind of go at a pace, but this is equivalent to 20,000. You can do this using 4 treatments in 45 minutes, or you can do 6 treatments at 40 minutes. Up to you. We can give you the same amount of energy that goes into it. But we can do the abdomen, we can do the butt, so it gives you more of a lift. And it does, they can't say it, but I can. It does reduce some fat. It definitely helps with your muscles. And once again, like I said, I have people who do this not just because they want a six pack, but because it helps their core muscles and they feel better overall. So we have a lot of people who do it. Like I said, one of the top people are golfers will do it. People who need to use their core muscles quite a bit. People stand a lot. They have some back pain because their muscles are weak. So it definitely does help with that. You wanna add something?
No, I mean, the doctor really hit the nail on the head. And originally, and this is still much very for aesthetic usages, but what it is doing, to her point, it helps people build their core strength, stand up straighter, get up easier, good for posture. We can do the stomach, buttocks, inner thigh, outer thigh, tris, bis, and you get about an 18 to 20% increase in muscle. Okay, and to the doctors, again, to piggyback on what she's saying, there is some sort of apoptotic cell death or fat loss around the midsection. So do you want me to set her up, doctor? Or do you want to too?
Yeah, I'll let you do.
Okay. It's a very, very simple setup here.
So, so I heard a little.
Right.
So we're gonna go slow.
Go ahead and pull your shirt up for me, please.
It's slow.
Okay, can you fold it on there?
It is, you will feel it. I will say that. But we go at your pace. Once we get you up to that level, most people are fine. But you will feel it. But you feel so much better after you've actually done it. And like I said, we have men, we have women who do this procedure, and it's not just to build a six pack. It actually does help medically with building your core muscles to kind of help alleviate some of that. So we're starting you off.
We're starting very low. It goes from 0 all the way up to 100%. And to kind of get you acclimated, we'll start at about at 20%. And so it's basically causing involuntary muscle contractions, right? So we talk about 20,000 crunches. What it really is just creating that. Okay. It's a very, very strong magnet. So in a sense, it's not to necessarily replace a workout. You could do that to use in conjunction with. We're also cleared for diastasis. So many of the women that have the ab separation, it works really well with that. So again, you know, outside of the aesthetic, it is kind of a well-being procedure.
Okay.
There's no cutting, there's no bruising. It's a 30 to 45 minute, depending on how the doctor chooses to do the settings. And you should feel good, kind of that workout high afterward.
I never tell people when I'm going up
Right.
because they're anticipating it. And so I just go up. Yes.
You don't get sore.
You don't. Like I said, this goes through different cycles where normally if you did 100 sit-ups, you'd be sore. So at different points during this procedure, it's almost like a tapping.
Okay.
It helps get rid of the lactic acid so it doesn't build up
Okay.
so that you're not as sore.
Okay.
Because if you did 20,000 sit-ups, I don't know how you would walk out of it.
Right.
So,
Does the ab separation come from like delivering children?
yes.
Okay.
So a lot of women may have it after they've been pregnant
Okay.
because your uterus becomes very enlarged when you're pregnant, and then those muscles sometimes splay. People who had C-sections because they actually have to separate the muscle in order to do the procedure. So, yes, it definitely helps. And yes, if you had a C-section, you can have this done. And once again, we have sports people who do this a lot because it helps build their core. And it's not cheating. It actually does help. And it's not invasive.
I want to know
How
how
you
she
feel?
Right.
Yeah.
It's funny. It's almost like some serious massaging going on.
Okay.
That's the best I can describe.
Yeah.
It doesn't hurt.
We don't start you at 100%. Here, can you guys come a little closer so you can actually see the muscle? You can see her muscle contracting.
What areas can you do this again?
So you could do your stomach, right? You could do your buttocks. You could do the inner thigh, outer thigh, tries, biceps. So a lot of the women that maybe thought about doing a brachioplasty but don't want the scarring on the back of the tricep, it's very nice to do the smaller applicators to build that muscle. It's very, very safe. It's just, you know, it's basically, again, very strong magnets. There's no bruising. There's no cutting. So, you know, as you can feel that it's very tolerable. And as you sit here, you kind of acclimate to that feeling.
Right.
And the next time you get on it, you'll be able to start maybe perhaps a little higher or quicker.
Okay.
So you can see that clicking. This is where it's actually trying to help to tap out the lactic acid. And you can see her.
And how many sessions does that vary depending on the person's, whatever their goals are? How many sessions do you recommend?
So usually so once again, it depends on how long you want to be on the device. So some people will do, because they don't want to come 6 times. Some people will do 4 treatments, but we'll keep them on it for 45 minutes. But I still tell people, now if you're not working out your muscles, it's gonna go, this is all meant to help improve your well-being. Right. And so this is not meant to replace fitness, but it definitely will help you. So when you are working out, you're doing the sit-ups, the different areas, you feel better and you actually get quicker results because you're also doing this in conjunction with it. But I'll tell people, we have people who they've done their initial treatment and then they do a maintenance. And the maintenance, everybody's a little different. What would you say? How often do you usually tell
So
people?
after from let's call baseline to full correction, obviously, you'll get a good several months out of it, but typically maybe once a month or once a quarter, depending on your body. And to the doctor's point, everybody's different.
Yeah.
So the maintenance program is great. You can keep this up going. There isn't any clinical data saying otherwise. But again, it's just a really good treatment for strength, longevity, standing up straighter, especially for the post-pregnancy women.
What is she on now?
You were at 48%.
Okay.
So I'm going to bring you up a tad,
Okay.
so we can really.
So you're
right.
so you're halfway there.
Right.
Halfway. So just imagine. But once you're on it for a while, you get used to it.
It still doesn't hurt, it just feels weird.
It's
It
not,
does.
it's not supposed to hurt. It's supposed to be comfortable, And you're getting very nice contractions. I know you're laying down, but you can really see your stomach.
Oh, I can feel it.
Yeah.
I can feel it pulling it up.
Yeah. So people get really good results with it. And they like it. And we could turn the lights down. I can't sleep through it, but some people have. But it makes, I don't know, it's going to really contract those muscles. And like I said, she's at a little bit over 50% now, but we try to get you to 100%. And usually, I go a little quicker because I'm in here having a conversation, and then we just continue. We talk through it, and most of the time, people don't realize that. Yes. Yes. But it's not painful. Like I said, the one thing is that people want results, but without the downtime. People are busy. I know a lot of people are working from home now, so you can bring your laptop. You're still working. You can continue working while you're getting your treatments done. We'll check on Stephanie to see how Stephanie's doing. So that's the cool stuff. We can go back to the first room so we can kind of see where we are. How much longer does she have?
Okay.
Okay, we'll check back. So she's back in. It's nice. It's not terrible.
Let them keep going. Miss Kathy, still tell her we're looking at the eyes. So, see what her eyes look like. You doing okay? Mm-hmm. So you can see the eyes are a little red. I think I'm getting the feedback. But once again, some people, if they have an event to go to and they want their eyes to be fabulous, we can do what's called a double treatment where we're actually doing twice the time. That actually gives you the appearance. Full collagen hasn't taken place, but it looks great, and within a short period of time. But she's doing great. Okay, you guys, while we're waiting, anyone have any questions?
Does this help in stretch marks?
It helps improve it, yes. Does it get rid of stretch marks? No. There are some things that may be a little bit more invasive, like we do microneedling with your plasma, so with your blood, we take the clear part off. That helps a little bit more with stretch marks. We have a laser called the Opus that will also help a little bit more with stretch marks.
Doctor, there's a question regarding the Emsculpt. What about abdominal surgery? Is it okay to do that after surgeries?
Yes, as long as you don't have, like if you don't have a pacemaker, if you don't have metal that's in, and this is for the BTL as well, if you have a copper IUD, you can't do the abdomen for the BTL. because it has radio frequency. Same thing with Emsculpt. So if you have metal, then you can't do that part of your body that has the metal.
What about cellulite?
So so it improves the appearance of cellulite. What cellulite is actually the dimpling occurs because there has been some scar tissue where there's different areas where scar has occurred, and so it pulls those different areas in it, and that's why you get the dimpling. So it will help the appearance of cellulite.
So
There are other things that
the
come out with now. One is an injection that actually helps destroy some of that fibrous material. Some improvements with that injection. The other one is going to be the lasers. They can be a little
No, you're
more.
not in agony, right? So you're in the gym doing
Yeah,
like,
it does.
I feel like
Sit-ups. I mean, it's
Right.
my least favorite
Mhm.
exercise. I do
Better
it because I have to.
of what everything looks like.
I don't know anybody that's holding
Planks and sit-ups.
The off.
And the planks that you don't have,
So
you're not
we'll
on
take
your
a
knees.
picture
You're
and
straight. Just sit.
so that you
Yes.
see what occurred before.
Yes. It's like, okay, can we stop? Even the trainer that constantly.
Very relaxing, not painful, no downtime. And
have you
that's
all
what a
worked
lot
with
of
the
people
trainer
are
in the gym
looking
here?
for.
No, I haven't
is
yet.
Oh, she's
not
great.
have
I heard she
She's
did.
great. She like added an app session on to the last
procedures.
workout we
They
did.
do.
Like listen right on the board.
But for those who are not interested or they don't really
You
need
do
to
a
have
thing,
an
you
invasive
do this, you do
procedure,
this. And I'm like,
these
slowly
are
crunching our head. I'm like, yes,
no anesthesia. We do have lactic gas. If you are just very anxious and you're worried, we do have that
Alright,
available.
anybody else want to try?
We're off in about 15 minutes, so you can drop away until everything is kind of worn off.
I can
But
take this for you.
it's a very, very tolerable procedure with
Is
no
it recording?
downtime. You don't have to tell somebody you had it done. Just tell them you've been working out. Or you just got genetics that make your skin look better. So she's all set. So how would you describe all that?
Relaxing.
So we missed the humming from Georgia.
We did in time. It usually happens when I don't even know.
So you can definitely tell she's got some tightening, it looks good, but the full results will occur in about 12 weeks.
Can we apply eye cream or serum after the treatment?
Oh, definitely.
Yeah.
And sunscreen.
And we will usually we'll apply sunscreen after we're done. And we have different eye moisturizers specific for the eye as well. But yes, you can use your makeup, you can do, we'll definitely put on sunscreen after you've actually had it done. So one of the biggest things I tell people about skincare, if you don't do anything else, you need to do sunscreen because you're trying to prevent the damage from the skin, from the sun. But you also have to reapply sunscreen every 4 to 6 hours because it wears off. So just FYI. So now we're going to go back over, check on our first patient that had the Coolsculpting done, kind of see how she's doing and how she's handling everything. But keep asking your questions if you have questions about any of the procedures. And then, like I said, you'll get to see how she looks after she's finished with her Coolsculpting. Well, first let's check on the Emsculpt and see how far up are you? Woo, so she's at 100% now. How are you feeling? Okay. You can definitely feel.
The tapping kind of breaks up the
Yeah.
the intensity of it. So it's okay. It's tolerable.
Yes. And like I said, you choose if you want to do 30 minutes or if you want to do 45 minutes.
Okay.
It's up to you.
None? All right, so we'll check in on the Coolsculpting client.
Twice a week.
Okay, so we're going back and forth room to room. So we have a
Four or
question about the BTL. Yes.
Like 4 or 6 sessions. So
Can
3
it
weeks.
help dark spots on the face?
We would have to see your face. So this isn't going to
Yeah.
change. It's not for discoloration. It is more for skin tightening, improving the elasticity of the skin, rebuilding the collagen. It won't help with discoloration.
Oh,
Absolutely. We have other things that will.
Even
and I
people
tell
who work at home, you know, and you get like in your comfy office chair and then you like spend a couple hours and then you're in your bad posture. So
evaluate, you can come in and take a look.
yeah.
Okay, now we're gonna head back to the first room to Coolsculpting. So she's all done. We'll take a look and we'll take pictures too. Before and after.
My daughter cousin.
So all finished. Good? Okay. The redness will wear off, but it's pretty relaxing for most people.
Grew up at Price Temple. Yeah.
How do you know Dr. Terry? How did you hear about Dr. Terry? Oh, there you go.
Yeah. You can say you're
And now all this stuff.
because it goes away.
You're like,
But it's
I'll be at my appointment. I have another appointment.
Okay, so we'll start back
Oh,
from
nice.
the beginning for the Coolsculpting. So we can check in on that first patient. I think she's almost done, and then you can see what the massage is like. So we're gonna go to the Coolsculpting and just check on her.
All right.
Toodles. What? She said toodles, and he said toodles. How are you? How are you? Oh, you know. If you guys want to see Coolsculpting, because she's gonna do the massage. If you want to see it. If you want to see her watch,